boy. Clip of Shepard Smith defending public option against Senator Barrasso from Wyoming. If you think I'm making it up, you're mistaken. Listen now.
Why would we not want a public option?
Well, let's take a look at what we do know. My concern is but I to consider a government takeover of health care is going to make it very challenging.
But it's not a government takeover, Senator. That's not fair, and we both know it. It's not a government takeover because what it would be is a government option. If you have insurance now and you like it, you can keep it. If you want the government option, a government-run, paid for by those who buy it, government-run option to try to keep costs down, that's not a government takeover.
So there you have the plant, the left-wing plant in Fox News, the overt one, or shall we say the covert leftist, Shep Smith, who I've called Schlep Smith for a long time. I've looked through his clown mask, and I didn't like what I saw inside. And I know the man is a diehard Obama supporter. I know that the man is a diehard socialist/Obamaite. And there he is inside the Murdoch machine. Now you say, well, that makes them fair and balanced. Good for you. Well, goody, goody, goody for you. But at least we are doing something for you that we think is important. We're being fair and balanced on the Savage Nation by showing you what's going on as we speak inside the Roger Ailes network right after who? Right after who visited Roger Ailes on the way back from the tarmac? Who was it? None other than David Axelrod, top guy inside the Obama administration. A few days later, here we have this petty stooge, Schlep Smith, taking the Obama line on what you thought was the conservative Fox network. I'll be right back.
Savage.
Veritas.
Would we not?
Hold on. No. Stop. I said I'm going to introduce it. Didn't you hear me? Veritas, truth. Okay? The truth shall set you free. I started this show by pointing out that Axelrod, a top official who runs the Obama White House, visits Roger Ailes of Fox News. I said to you earlier in the show, watch out and watch the change in the talkers on Fox News. Watch the positions change slowly. Little did I know how prescient I was, because this afternoon, Schlep Smith suddenly and shockingly supported Obamacare 100%. Listen.
Why would we not want a public option?
Well, let's take a look at what we do know. My concern is but I to consider a government takeover of health care is going to make it very challenging.
But it's not a government takeover, Senator. That's not fair, and we both know it. It's not a government takeover because what it would be is a government option. If you have insurance now and you like it, you can keep it. If you want the government option, a government-run, paid for by those who buy it, government-run option to try to keep costs down. That's not a government takeover. Healthcare costs in America have
Let's stop right there. Stop right there. Now, first of all, he's wrong and/or he's lying. It's not a government option in the sense that you may think of just a fair competitor in the form of a government option. When you put government into a private enterprise system, the government will always win because they have literally no concept of meeting a payroll or costs or such. So they could charge anything they want and just bill it back to you as a taxpayer. So the real attempt with this government option is to drive private insurers out of business entirely and make it simply a government insurance program. So the Republican senator is 100% right. It is a government takeover of the insurance side of health care, which is exactly what Obama wants to do, because he who controls the insurance controls the entire organizational principle. Was there any more of this? Let's listen to Schlep Smith from Fox. Go on.
Healthcare costs in America have skyrocketed. Regular folks cannot afford it. So they tax the system by not getting preventative medicine. They go to the emergency room and are at a last case, and we all end up paying for it. As
you don't pay for crap. Hey, look, shut up. I can't listen to this character anymore. I've listened to this adolescent schmuck for years now. I can't stand him. And let me tell you something else. Everything he just said is right out of a talking point from the Obama administration. As I stand here, he was told to say this as the most liberal member of the group there on Fox News. Look, I've long seen the mixture there, and they're entitled to do what they want. They want to become another MSNBC, they could do that as well. You, the people, may or may not even see it. You may not even care. It doesn't matter to me. What matters is the man is absolutely factually wrong, and he's lying. He is totally lying about everything he just said. Now, let's start with the emergency rooms and who uses it. The majority of people who abuse the emergency rooms are illegal aliens. The health care bill that is before the Congress right now insures for free illegal aliens from Mexico, Guatemala, El Salvador, and you name it. La Raza has an office inside the White House. La Raza is calling the shots on this health care debate. And Shep Smith may or may not know that. I think he's actually a facile man who knows very little. He's just a sort of a clownish guy who reads what they tell him to read and what his friends tell him to say at night, so he's slapped on the back in a bar at night. But the fact of the matter is, Shep Smith is all wrong. It's not just an option. It's the takeover of the insurance portion of the entire health care insurance system. Number two, why do you think health care costs are out of control? Well, there are many factors. Why didn't Shep Smith, who was all of a sudden so passionate about controlling health care costs, talk about the $500 billion to $1 trillion a year that lawyers suck out of the health care system by busting out doctors and hospitals? There was a very famous presidential candidate named John Edwards, a man with a mole on one side of his face who ran for the presidency. I knew that the man was a fraud from top to bottom. I don't know how you couldn't see this guy. You could look at the guy and see he's a faker. Here is a guy who made his fortune by going around the South, uneducated areas in the South, by the way, and convincing toothless descendants of what do people? What do they make in shacks? What kind of bootleggers? Toothless descendants of bootleggers up in the mountains that the doctor caused a congenital disease, or that the hospital's mistakes caused a congenital disease. In other words, if a poor child was born with a birth defect, this shyster, in my opinion, went around to the toothless morons in the mountains of that area and said, look what these doctors did to that poor child. Now, you don't want that poor child to suffer, and I'll tell you, we've got to get some justice for this child. This poor child, look at him, he's going to suffer. He's going to need the wheelchair. He's going to need this chair. He's going to need that chair, your chair, my chair, and we need $402 million to help this child until he's 21 years old, all because of that evil doctor down there in that evil city where all of those liberals live. And he won hundreds of millions of dollars for years from juries all over the Southeast, and that's how he made his fortune. So you'd say if you want to control health care costs, what you do is you cap the amount of money that the shysters can squeeze out of the system, and you'll say, well, that can't be done. It's been done in California since almost 20 years now. Whether you know it or not, it's strange that California, which is wrong in so many ways, had this law put in 20 years ago where lawsuits, medical malpractice claims, cannot exceed $250,000. So as a result, the worst vermin in that field, the tort lawyers, the worst of them, the lowest of the low, mainly from Brooklyn, who came out here during the hippie era, put on love beads and smoked dope and screwed their neighbor's wife, they left. They moved on. They went to states where they could ply their hoary trade. And as a result, people don't have these leeches in the system. What we have now is a cap on the amount of a lawsuit. Now, what would be wrong with putting a cap on medical malpractice claims, Shep? You can't say that. Why? Why can't you say it? Because your talking points didn't include it, number one. And number two, you're actually in favor of lawyers raping the system like the leeches they are. Otherwise, you'd be calling for tort reform within the system. People who have studied tort reform of this nature have said that there's between $500 billion and $1 trillion in lawsuits that would account for a savings of the same amount should they be capped at $250,000 per lawsuit. That's an awful lot of money that could probably pay for health care reform. Now, in addition to that, you put a highway patrolman in every emergency room in America, whether it's in Missouri, California, New York, Ohio, doesn't matter where. You put state troopers inside the emergency room. No ticky, no laundry. You show your citizenship papers or you're not going to get free care. It's not that we're not compassionate. We don't have the money. We can't afford it. Now, of course, if you're in an auto accident or something like that, you're going to get the free care anyway. But you're not coming to this country and going to get a cardiac bypass for nothing. You're not going to bring your child in who has the sniffles and demand $4,000 worth of care in order to get the care of a doctor, because that's what they're doing. They're busting out America. All of this can be traced to the lawyers and illegal aliens. Almost the entire breakdown in the health care system in this country can be traced to three elements. I didn't mention the third one yet. I've studied this in great detail for 25 years. 1, put a state trooper in every hospital, no free care to illegal aliens unless it's a life or death situation, number 1. 2, cap all medical malpractice lawsuits at $250,000. And 3, hire 1,000 new lawyers to go after the fraud in the medical system. You'll find that there are trillions of dollars that could be saved virtually over the next few years. There will be no need to raise taxes, and you would have the best health care reform the world could ever ask for without destroying the best health care the world has yet seen. Those are solutions. I've given you solutions in the past. As you well know, they are not heard by anybody except you, the faithful audience of the Savage Nation. Spread it to your friends. Spread it around to your friends by the internet.
Savage.